Well, guys, this is Bruce. Our research topic is a study on the healthcare cost predictions. Mention 2021, and what comes to mind is the outbreak of the COVID-19 disease. In the United States, high medical costs hinder some residents from accessing better medical services, resulting in a public health crisis. So consider the rising medical costs in the United States. We consider whether we can establish a model to predict the future medical costs. Therefore, our studies aim to explore what factors affect healthcare costs in the United States and make a prediction of healthcare costs. We collect our data from the CAGO website. There are 1,338 observations in our dataset, and we included 7 variables. The first variable is the insurance contractor age. The second variable is gender. The third is BIM. This is the body mass index. The fourth variable is the number of children covered by health insurance. The fifth is the smoking. The sixth is the beneficiary's residential area in the United States. The last variable is the individual medical cost billed by the health insurance. So my partner, we're going to introduce you how these variables correlate with each other and what's the result of the regression model and how this regression model performs compared with the data from the real world. Thanks.
Well, after Bruce's introduction, I will do our project's overview. First, we mainly did the correlation of those different variables: charges and age and BMI, charges and sex, children, charges and smoker region. The result will be illustrated by another group member. After that, we construct the linear regression model of all the variables we find. After building the regression model, we could select 5 variables have significance: age, BMI, children, smoker, and region. Within those variables, we find apart from the region, other 4 variables have stronger significance. Furthermore, we continue to build a new model using the rest model variables. To be more specific, we compare these 2 models, finding similar performance, which is shown from the 4 diagrams. We can see the errors in the model are close to 0, so model predicts quite well.
We have studied the relationship between the charges and the 6 factors, including age, BMI, sex, children, smoker, and region. Through looking at the plot, we can see that there are positive relationships between the charges and the age, and between the charges and the BMI. It indicates that when the age or BMI increases, the charges will also increase. It makes sense that when people get older or heavier, they are more likely to have health problems and incur more health costs. And through looking at these 2 plots, we can see that there are neutral relationships between the charges and the sex, and there are little negative relationship between the charges and the children. Charges for insurance with 4 to 5 children covered seems to go down. And looking at these 2 plots, we can see that there are positive relationship between the charges and the smoker. There is a significant gap between the smokers and the non-smoker. The smokers' charges are obviously larger than that of non-smokers. It indicates that if people smoke, the charges will also increase. And the last plot shows that there is a neutral relationship between the charges and the regions.